See, this is the picture that is shown in most baby food advertisements, that the parent gives the food to the child and the child is very happy to receive it. But if any of you has little cousins, if any of you have observed a baby at their own home, you would know there's another side to this story. Yes, this would be the reaction of the child usually, right? Those of you who have a little experience might know with little kids. This is because children have a mentality that the food that they receive at home is not so special. But if someone else from outside the family, perhaps a neighbor or a friend, someone that they admire, if someone else gives them the same food, they will accept it from a guest rather than from their own home. In the same way, the liver also, though it has the hepatic vessels to give its blood supply, the liver is not very interested in receiving the nutrition from the hepatic vessels alone. Instead, the liver wants the nutrition from a guest, that is the portal vein. So keep this in mind. Hepatic vessels give only 20% of the nutrition to the liver, whereas the portal vein, which the liver prefers, metaphorically, supplies 80%, contributes to 80% of the blood circulation within the liver. So let's see what exactly happens regarding these blood vessels. So whenever you're describing blood supply of liver, make sure this is your introductory statement. Hepatic artery is a branch of which artery in the abdomen?
Common hepatic arteries.
Yes, common hepatic artery is a branch of?
Celiac trunk.
Celiac trunk.
Yes, very
Celiac
good.
trunk.
Celiac trunk. Celiac trunk is a branch of the abdominal aorta. So the celiac trunk is also a separate short note for you. There is a diagram that you have to learn for that, which will make the whole thing simpler. Okay, so this picture shows you that the hepatic artery will be carrying oxygen-rich blood to the liver, and hepatic vein will take away the deoxygenated blood from the liver and take it to the systemic circulation through the inferior vena cava. Meanwhile, the liver also receives the nutrient-rich blood from the portal vein. The portal vein will carry the products of digestion from the gastrointestinal tract towards the liver. This will aid in the metabolic functions of the liver as well. So do you remember how do the hepatic vessels and portal vein enter into the liver, or what are the structures arranged in order at the porta hepatis?
DAV.
Yes, DAV is from
Anterior to posterior.
yes, from anterior to posterior. So what do you mean by DAV? From anterior to posterior, it is the common bile duct, the hepatic artery, and the portal vein. Let's look at the hepatic artery. You can see it divides into two branches. This is the right hepatic artery. The right hepatic artery will be supplying the right lobe of the liver, and the left hepatic artery will supply the left lobe. At the microscopic level, the liver, it is made up of cords of cells. These are the cords of liver cells, labeled in brown. And in between the two cords, you can see there is a dilated venous space. This is called the liver sinusoid. Now, here in red color is a branch of the hepatic artery. This is called the interlobular branch of hepatic artery. And can you see that this hepatic artery branch is going to communicate with the liver sinusoid? That is how the blood is distributed into the tissues of the liver. Okay, from sinusoid, there will be diffusion. And finally, the blood flow is towards a central vein. You will now, when you look at the portal veins branching pattern is also similar to the hepatic artery, as you can see in this diagram. The portal veins further branching, we call this tributaries of portal vein. It is very similar and closely follows the pattern of branching of the hepatic artery. And here in the diagram at microscopic level, also you can observe that the portal vein as well will join with the hepatic sinusoids. What about the central vein? It will finally form hepatic veins. Okay, the central vein will give rise to 3 hepatic veins. Here in this diagram, the first diagram, you can observe what is labeled as hepatic veins. There are 3 in number. And we learned last time that finally this hepatic vein, which carries the deoxygenated blood, will join with the inferior vena cava. There are 3 different classifications on how the liver is divided. One is how to divide the liver into anatomical lobes. So can you tell me what ligament is present on the anterior surface of the liver to divide it into right and left lobes? Falciform ligament. Good answer. So in this diagram, you can see this is the falciform ligament, which divides the liver into a large right lobe and a smaller left lobe. Let's look at the posterior surface, okay, or the posterior view of the liver. There are 2 grooves present here. Okay, I'll just be labeling it for you, which is the groove or the fissure for ligamentum venosum, and this is the groove or the fissure for ligamentum teres. Now you have to imagine there is a line passing through these 2 grooves. So the imaginary line passing through fissure for ligamentum venosum and fissure for ligamentum teres divides the liver from the posterior aspect. So this line will divide the liver into a smaller left lobe and the larger right lobe. In addition to this, please remember the right lobe of the liver anatomically also contains the caudate lobe and the quadrate lobe. How is the liver divided into different lobes based on the function? For this, we need to remember a different line passing through the liver. This is called the cholecystovena caval line. So as the name suggests, cholecysto. Yes, what does this word refer to? Any idea? Which organ does this word cholecysto refer to? Anybody?
Gallbladder.
Yes, you hear the word cholecysto. It refers to the extrahepatic biliary apparatus. The word cysto specifically refers to the gallbladder. The cholecystovena caval line means a line passing through the fossa for gallbladder and also passing through the groove for inferior vena cava. There's another word for this line. Yes, you think that the liver is a straightforward organ and very honest. Okay, the liver can't lie. Okay, can't lie, or the can't lease line. Okay, whatever floats your boat, you can just remember that word, the can't lease line. The can't lease line divides the liver into the functional left lobe and the functional right lobe. So based on this classification, can you tell me the caudate and the quadrate lobe? do they belong to the right lobe or the left lobe of the liver? Caudate lobe and quadrate belongs to the left lobe of the liver. But also remember, the caudate lobe has a small process here called caudate process. The caudate process belongs to the right lobe here. It is based on the area of drainage of bile by the right and left hepatic ducts. Finally, I know some of you are going to be future surgeons, very interested in surgery. So based on the clinical aspect or based upon the surgical procedures, there's one more classification for how we're going to divide the liver into different lobes. This is called the Coynard's segments. Coynard is the surgeon who described it. So this person wants to make things a little more complex because so far we've been dividing the liver only into right and left lobes, and we are including the caudate and the quadrate lobes. But now this really talented and intelligent surgeon, he has divided the liver into 8 segments. And this division is based upon the fact that each of these 8 segments, they have an independent branch of hepatic artery, a separate branch of bile duct, and is drained by a separate tributary of hepatic and portal vein. And in between the segments, the main hepatic vein passes through. Okay, the hepatic veins are intersegmental in position. So how do you remember the numbers? Okay, this side 1 to 4 is termed as the left hemi-liver. And if you observe carefully, the labeling 1 to 4 is labeled in a clockwise direction. Okay, 5 to 8 is in the right hemi-liver. And this segment 1 is actually the caudate lobe posteriorly. And the clinical importance of this is that if there is any disease process affecting a single segment, we can perform segmental resection of that segment alone without disturbing the anatomy or the function of the other segments. Development of the liver is from an area called the liver bud or the hepatic bud. Okay, so usually all students will remember the liver bud, but you also need to know the liver bud arises from which structure. Okay, so in the embryo, around the 30th day, the hepatic bud will arise from endoderm of foregut. This hepatic bud will divide into 2 parts. That is pars hepatica and pars cystica. So the name will give you a clue that pars hepatica is for development of the liver and pars cystica is for development of the gallbladder and the bile ducts. Here, this is the section of the embryo. You can see the hepatic bud here arising from the foregut, from the GIT. Now, in the embryo, there is a partition being formed between the thoracic cavity and the abdominal cavity. So this partition in the embryo is called septum transversum. Please remember this word, septum transversum. The cells of pars hepatica will invade or enter into septum transversum, and these cells will divide to form the lobes of the liver. When I showed you the picture of microscopy, you saw a few cords of liver cells. The cords of liver cells are formed from the pars hepatica, whereas the sinusoids within the liver and also the capsule of the liver known as Glissen's capsule is formed from septum transversum, inferior to the diaphragm and related to the liver. There are 6 subphrenic spaces. Now, this is a short note for you. It is sometimes asked in your exam. So please learn from your textbook. What are the 6 subphrenic spaces and what are the boundaries? Meanwhile, I'll just tell you a few points which are really important. Okay, suppose this is the sagittal section of the abdominal cavity, and we're looking at the liver on the right side. Okay, over here, labeled posteriorly, is the right extraperitoneal space or bare area of the liver. So based on your knowledge from the previous class, can one of you tell me a clinical importance of bare area of the liver? What is the clinical importance?
Infections can spread from liver to lungs.
Yes, very good. Infections such as the amoebic liver abscess, if it's present in the bare area of the liver, the abscess can rupture through the diaphragm and enter into the pleural cavity or affect the lungs. Yes, very good. That's about the right extraperitoneal space. Also, there is portosystemic anastomosis in this area. Okay, there's one more space here, which is related to the right kidney, which is called right posterior intraperitoneal space or hepatorenal pouch of Morrison. Okay, this is on the left side. Okay, here. There's something called left posterior intraperitoneal space. Okay, this is the space that is posterior to the lesser omentum. So do you remember posterior to lesser omentum and stomach? The peritoneal cavity has a compartment known as lesser sac or omental bursa. The abdominal pelvic cavity when the patient is lying down in supine position. You can see there are 2 areas which are called the dependent areas of the abdominal cavity and pelvic cavity. The dependent areas are the spaces in which fluid will collect in case of any pathology. So in the abdominal cavity, the most dependent part in the supine position or the recumbent position is the hepatorenal pouch of Morrison. Okay, in the standing position, especially in females, the most dependent part of the abdominopelvic cavity is this space called pouch of Douglas. Now, in females, it is the recto-uterine pouch. In males, it is the recto-vesical pouch, or it's a pouch between rectum and urinary bladder in males. In females, it is a pouch between rectum and uterus. Okay, so please keep in mind this pouch of Douglas or recto-uterine pouch, because when you are learning about surgical anatomy or anyone who wants to be a gynecological surgeon, okay, this recto-uterine pouch is where you will look for fluid collection in case of any bleeding within the abdomen, especially related to pregnancy. In pregnancy, there is a little rare condition called ectopic pregnancy, where the embryo will be implanted within the fallopian tube. So that will cause a rupture of fallopian tube and the patient will be bleeding into the pouch of Douglas. So you have to look through ultrasound if there is any fluid collection in the pouch of Douglas. So all that is just a series of pictures is to show you how the liver regenerates even after a part of it is excised. You can see how this cut portion is regenerating to an entirely new liver. So, sagittal section of the abdominopelvic cavity, which will show you the different tracings of the peritoneum. Okay, When you take a section, this hollow organ is the stomach and the large intestine, and here is the small intestine. Okay, this is transverse colon. These are the loops of small intestine. So now related to the stomach, okay, here is lesser omentum. Lesser omentum is the peritoneal fold between lesser curvature of stomach and the liver. So this space, which is labeled in blue color, which is posterior to lesser omentum and posterior to stomach, this space is called lesser sac. Whereas the rest of the abdominal cavity, okay, which is colored in yellow and in red, that is called the greater sac. From stomach, what hangs like a curtain downward is greater omentum, this peritoneal fold, which is large. So this arrow shows you there is a communication between greater sac and lesser sac. Can you tell me what is the name of the area which will communicate the greater sac and the lesser sac?
Epiploic foramen.
Yes, very good, Rini. It's called the epiploic foramen or foramen of Winslow. Okay, and another name for lesser sac is omental bursa. Sometimes the examiners will like to test your knowledge by asking about omental bursa. That time, don't think it is something foreign. Omental bursa is just another word for the lesser sac. Okay, please learn about boundaries of epiploic foramen and vertebral level. Now, why I'm telling you about epiploic foramen is that at epiploic foramen, there is a free edge of lesser omentum. The free margin of lesser omentum has three important structures. Yes. What are the three structures that are present at the free margin of the lesser omentum?
Bile duct,
Yes.
hepatic artery, and hepatic portal vein.
Yes. Good. Malavika. There is the common bile duct, hepatic artery, and the portal vein. In your dissection, you will be putting your finger through this area. Okay, so remember I told you posterior to this lesser omentum and stomach is the lesser sac. So where the index finger is going is actually into the lesser sac. Whereas anterior to the stomach, the rest of the abdominal cavity and related to the greater omentum is the greater sac. So this ring through which you put your finger, this ring is actually the epiploic foramen or foramen of Winslow. I just want to ask you a clinical question. Suppose you are the surgeon operating on a patient in the abdominal cavity. You're performing a surgery. And then you notice, maybe because of some injury, the liver is bleeding profusely. Okay, the liver, we learned the blood supply of the liver. It's a very vascular organ, and any injury to the liver will cause profuse bleeding. As a first step, is there anything you can do as the surgeon to reduce bleeding from the liver?
To compress that part.
Yes, you'll try to compress the part from which the bleeding is occurring. So when the liver is bleeding, which vessel will you try to compress?
Vein and hepatic artery.
Yes, Malavika. Good. I think all the other aspiring surgeons are a little tired by now. That's why I'm not getting the answer. Anyway, the answer is, I told you that these structures are present. The hepatic artery and the portal vein, they are present in the free edge of lesser omentum. So you can try as a surgeon, as an immediate measure, that through the epiploic foramen, you can access the structures at the free edge of lesser omentum, and you can apply a clamp on the hepatic artery and the portal vein. So this will reduce the bleeding from the liver Once the bleeding has reduced, you can find out what caused that bleeding and you can repair that area. You can save the patient. What is the name of the maneuver? I will show you a picture and you have to tell me the name of the maneuver. Okay, class, this is your last question for today. Yes.
Fingers.
Yes. Pringle maneuver. Okay, that's the name of the surgeon who has devised this strategy. The healthy liver, and this is a diseased liver. Yes, this is the liver which has the disease called cirrhosis. So can you tell me the most common cause of cirrhosis in Kerala?
Alcohol.
Yes, alcoholic liver disease. So why does this liver become like this? It's because we learned that the liver has a regenerative capacity, such a wonderful organ. So even if a person takes excessive amounts of alcohol and a part of the liver is damaged, what does this faithful liver do? The liver will regenerate and heal on its own. But every time the liver heals from such metabolic damage, there will be formation of scar tissue. That is fibrosis and nodules will be formed. So this state of the liver, what it is seeing in the picture, it happens only when the person continues excessive alcohol consumption. So the liver has to keep on regenerating. It will keep on forming scar tissue and nodules. And finally, it becomes like this, the nodular appearance of cirrhotic liver. Now, even when the liver looks like this, the poor liver will still maintain a good function. Only in the end stage of alcoholic liver disease, the patient will have liver failure, which leads to collection of fluid in the abdomen, which is called ascites, and a whole lot of other features. It is not an easy thing to witness or to treat. Okay, in fact, ascitic liver is said to be the beginning of end of life for the patient. Because once the patient reaches this state, the only hope of treatment is liver transplantation. And it is not very easy to acquire organs, especially for people with addictions. Getting an organ for transplant is very difficult. So as you all know, prevention is better than cure. So when, yes, you are created with such a wonderful, healthy liver with a regenerative capacity, please take care of your bodies and do what is good for yourself, especially as you are doctors. Please read about liver biopsy. Okay, I'll just say it is done in the mid-axillary line, 9th intercostal space. Just for completion's sake, you can learn a bit about lymphatic drainage and the nerve supply. With that, we complete today's class. Yes. Thank you, class, for your patient listening.